It's time for Bring It In, troops. Little from quarantine show, and there's David Thorpe, and we're super excited. We have like a celebrity doctor here today, Dr. Michael Mina. How are you, sir?
I'm doing very well. Thanks for having me.
You just casually mentioned that you were on the phone with a senator. That's because you have a very exciting message here. Let me read your bio quickly. Dr. Michael Mina, MD, PhD, is an assistant professor of epidemiology at the Harvard T.H. Chan School of Public Health and a core member of the Center for Communicable Disease Dynamics. He's additionally an assistant professor in immunology and infectious diseases at HSPH and an associate medical director in clinical microbiology, molecular diagnostics, in the Department of Pathology at Brigham and Women's Hospital and Harvard Medical School. Thank you, sir. Thank you for joining us.
Yeah, very happy to be able to get on the show.
So you, David made me aware that you were on the must-listen show This Week in Virology, which ironically went viral. And Malcolm Gladwell tweeted that it was basically the best thing he'd ever heard. What have you done? What's your message here? How are you getting everybody so excited? What's going on?
Well, so the main message is really one that has come out of just necessity, and that's that I think most people, anyway, if you haven't been under a rock, you know that testing has been this major fiasco. People are having a really hard time getting tested for COVID. The results when people do get tested, the results are coming back sometimes a week, 2 weeks, 3 weeks later, which for all intents and purposes makes these tests completely useless when you're getting a result back 10 days later. There's just no point even doing the test, frankly. And so what I've been advocating for, and I think there's good reason, and we can go into the detail if of interest, but it's these really rapid tests that people could potentially use. What I want to see is I want to see a day when every single American can wake up and they have a box of 50 tests for coronavirus right next to their bed, and they just sort of use one in the morning, and if they're negative, they go about their day, and if they're positive, then they know that they need to stay home. And this could be a way to really curb outbreaks where they're happening. And we of course know that these outbreaks, the half the country is on fire right now with this virus, and the other half was on fire and probably will be again. And we really need to change, what we're doing. And testing is a major way that we have to control outbreaks like this. And but currently, the U.S. testing program is failing, and so I'm really pushing for a new model.
And I think comment hearing that is, but that doesn't exist. That's an idea from outer space. But you're saying, no, I have samples in my office.
Yeah, so the manufacturing and the actual the tests are not yet on the market, and there's an unfortunate reason for that, and I'll talk about that. But they can exist is the point. These tests, they're little paper test strips, and you could think of them like a pregnancy test. Very different function, but they're as simple to use as a pregnancy test. You just would either take a swab of yourself, dunk it in some saline, like contact solution type stuff, and then put a drop of that onto one of these paper test strips, or just stick it in your mouth or whatever, spit on it, however it's made. The point is that the core technology exists. We can actually make these things, and but there are some molecular characteristics about it that the FDA doesn't really like. Food and Drug Administration, that kind of regulates all of these tests. This is that whole EUA process that you might have heard about, the emergency use authorization that's needed to be able to test somebody for coronavirus. The tests need to be authorized by the FDA. So that normally is a good thing. But in this case, they have the bar set really high for what constitutes a useful test. And it's all centered around the type of quality of test that we need in the hospital when somebody shows up really sick. We want to have as absolutely accurate a test as possible. If you have one shot at goal for a test, you have a person come into the doctor's office, you might never see the person again. You want to give them the absolute best test you can. What I'm advocating for is that we take it out of the clinics, we take it out of the hospital, and we just have everyone use a test every single day. And if you have a test that you're using every single day, then even if the quality of each individual test isn't quite as good, it means that overall, your chances of finding people when they're infectious with the virus and asking them to self-quarantine is actually much higher than, for example, if we're just kind of randomly giving everyone a PCR test once a month or once every 5 months. Most people haven't even had one test, no less two. And that's not a way to control outbreaks. We really need to get people tested frequently. And so I'm saying, look, we can actually compromise a little bit on the quality because it's kind of the area under the curve. It's like the frequency more than makes up for the molecular sensitivity of these tests. But it really is a counterintuitive, and we've shown this with mathematics and actual research that this would work very, very well. But it's a counterintuitive finding to suggest to the FDA, hey, look, we need a less sensitive test as long as it's cheap enough that people can use it daily. That gets them very confused because they're used to just calling for more and more and more sensitive tests. And this is the wrong way to go about it, because sensitivity, you get the more sensitive it gets, unfortunately, the more expensive it gets, which means and the more it needs to be sort of funneled through a central laboratory. And you end up where we are today with labs that aren't turning around test results for weeks potentially, and very expensive. And that is obviously untenable for daily use.
But is part of the problem also when you talked on the podcast that I listened to, you talked about the rate of transmission, what needed to be in your system to be able to really transfer to someone else, and you had mentioned that's part of the issue with sensitivity, is that we're picking up virus in people that don't have enough to transfer it. So they're testing as positive, but aren't really in danger of spreading it. Can you talk about that some?
Absolutely. So that's one of the major findings, and it's one of the least intuitive, because in general, when we're thinking about lab testing like this, we're not normally thinking about sort of what the virus is doing inside the body. But the reality is we have tests right now that are able to pick up very small amounts of the genetic material of this virus, but such small amounts that if somebody recovers from the virus, they'll stay positive potentially for weeks. And so that means that if you go and take somebody who already has gotten over their infection and still has some of this residual RNA, this genetic material from the virus sitting in their nose, you might go and test them 3 weeks later after they've totally recovered. And if that's the first test that they've had, then you'll test them with a PCR test, these really sensitive ones, and then you'll quarantine them for 2 weeks because of it. And meanwhile, they've actually been over their infection for 3 weeks. And so in some ways, the really sensitive tests that we have currently are almost giving, I think of them almost as a false positive. They're actually picking up real material that's there in the nose, but for our purposes, they're actually almost too positive, too sensitive, and they're actually erroneously quarantining people. And the reason why these lower sensitivity tests can actually work is because inside the body, when somebody gets sick, the virus grows from like 1 viral copy to 1 billion viral copies. And so, and people,
over how long?
So that window of time really only lasts for a few days, probably, when they're really at a peak of having like 1 billion copies in their nose. The body can't sustain that for very long because the virus is replicating exponentially, and each time it replicates, it has to eat up some cells. And so if we're going to live through the viral infection, like the body really can't keep that sort of really high viral titer for very long. So what I'm calling for is suggesting like, okay, people are really only transmitting, for example, when their viral titer is probably above 1 million. So if we're using a test every single day, then we don't have to care about detecting people when they have a viral titer of 1 or 10. Because that's generally not useful. It's not dangerous in terms of transmission. And as long as somebody's largely asymptomatic, then we really just want to make sure that we're asking them to stay home, at the very least on the days when they're transmitting. And so if we can get a test that can detect just 1 million copies or more instead of 1 copy or more, then we're able to essentially have what I would call these as almost like transmission detectors. They're the type of test that would let you know when you're at risk of spreading it to other people. And if we can stop people from going out and roaming about the world just on the days when they're transmitting, and we ask them just to stay at home, on those 4 days, then that alone would really cut transmission tremendously. And then, it also helped people get back to work sooner. We wouldn't be keeping them in quarantine for 2 weeks, and we wouldn't be erroneously calling them positive, 3 weeks after they've already recovered and putting them in another 2 weeks of quarantine. So there's a lot of reasons for this approach, but it's just it really takes some. It takes recognizing how the virus grows inside of the body to be okay with it. Because a lot of people would feel pretty uncomfortable getting a PCR test, these really sensitive tests, having it show positive, and telling that person, oh, it's okay, you're positive, but look, your viral load is so low that you can go and walk around. A lot of people wouldn't be comfortable with that. But what I'm saying is actually, a lot of the times you can say that, because a lot of times it's actually just showing up with the positive that there's no living virus in the person anymore. It's just I have an analogy for it, which is a weird one.
No, I want to hear it. I like this one. I was hoping you'd say it. Yeah, it's great.
It's the analogy is when we're detecting just the genetic material of this virus, it's like say that you have a serial killer on the loose, and the cops kill the serial killer. They find him in the street, kill him, and he's gone and dead. And then you go and pick up a piece of his hair, and you run it through a DNA sequencer, and you say, aha, like we still have hair from the serial killer. Well, the serial killer is not alive. You don't have to be worried about this person anymore. It's just that you're detecting the genetic code in the piece of hair. It's very similar to what we're doing with this virus. We're finding the genetic code long after the virus is dead. And it's because genetic code is really stable. It can stick around in the environment for a long time. And so, we shouldn't be using that as our metric for what's dangerous or not. That would be akin to looking at fingernails and hair of dead people and saying that they're dangerous. And that's just, a ridiculous thought, I would say.
They're not going to get my hair. Dr. Mina, are you an NBA fan?
I am. I've never been into sports, to be honest. I was a rower in college and in high school, and I competed at the national level. But other than that, I've always been into more endurance sports. But I have a lot of respect for the NBA. The athletes are amazing, as far as I'm concerned.
So they're using by back of the envelope math, they're using about 1,500 PCR tests a day to get this bubble working. And I think the nation's doing about 700,000. So I did some amateurish math here, which means it's roughly, obviously, one per person in the NBA bubble and one per 500 Americans outside the bubble. Is that okay? Is that reasonable? This is a finite resource. Is the NBA consuming more than its fair share?
Yeah, absolutely. But I think that there's different ways to look at it. If you're asking me from a public health perspective, is it the absolute best population to use it in? I would say that these are pretty well-off people who are, there's a lot of not well-off people in this country that are dying of this virus. That said, I think actually, the NBA could. There's other options with this test that could actually allow the efficiency of the testing to become much more efficient and the usage of materials to be reduced. Of course, it would take I think actually with no real change, just a slight tweak in how the data is being used could be one thing. You could treat it as a surveillance program for the bubble, and if there starts to be any prevalence in the population, then you kind of use more resources and test everyone, but you could potentially pool a lot of samples together. And if you even more than 5. So right now the FDA has essentially said, oh, we'll pool 5 samples together and that's okay for some of these tests. I think you could pool 20 or 30 or 40 samples together actually, and really reduce your usage of the tests. And if you were to do that, that would make everything more efficient. And then what you'd have to have is some sort of adaptive testing program where if on a given day you find that one of the pools turns positive, then you have to go and find out who in that pool was actually the positive individual. But if you're getting a 40-fold reduction in tests or efficiency gain in tests by pooling 40 tests at a time, then that brings you a really long way, so that it allows you to conserve resources. And when you do need to do the more broad test, the individual testing, because a test turns positive, then you could potentially you could do that. And I think that there's ways to go about it. The FDA is a little bit, they haven't been completely clear on what the real regulations are from their perspective, but I think that there would be ways to do that. And I think it's a way forward for sports, for leagues, things like the NBA, where there is society has to go on. And I would say that the NBA is a pretty big part of our society in the US anyway. And so we can't just say all things like the NBA and everything else have to shut down because other populations need these tests. And so I think if we can all think creatively about how to use tests more efficiently, including hopefully these paper strip type of tests in the future, then I think that there's some real, hopefully society can move on, and we wouldn't have to be having this conversation at all.
Can I say this back to you and see if I got it right? So basically, let's say we're the Los Angeles Clippers. I think their traveling party is 35 or so people in the bubble. So they could nasal swab 35 people every day, put it in the solution, send one batch of solution to the lab. And then because of the virus, because it goes over 4 days from 0 to 1 billion particles, if just one of them is positive, it'll be obviously that group is one's transmitting, I guess. It'll obviously give you a chance to quickly find who's the culprit here.
That's right. And there's ways to pool. So a lot of the discussion around pooling of samples has assumed that there's going to be a dilution effect. And so people said, oh, if you pool 10 samples together, then the sensitivity goes down tenfold. That's not actually, there's ways to not have that happen, where if you're taking all of the swabs, say you take 30 swabs or 40 swabs, and you stick them all into one tube of solution, then actually that will boost the signal. If you have, let's say you have one it won't dilute it is the point. What dilutes it is when you stick each swab into its own solution, and then you just take a small few microliters of each of the 40 solutions and pool them together, a true pooling. That dilutes it. But in this case, I'm actually suggesting that all the swabs go into the same 1 milliliter of fluid. And that would, the benefit there is you don't dilute the sample at all. The detriment is if you get a positive pool, you don't have the primary specimen to just kind of deconvolute it right away and figure out which is positive. You have to go back to all those 40 people and say, hey, all 40 of you have to stay inside for right now until we root out who is positive. And so it adds maybe a day delay to figuring it out. But, I think that's a pretty good gain if you're, overall. And the hope is with the bubble, I think, and I haven't followed closely enough to know if there's been any positives. But the hope is that there won't be any, and so this can really, or there will be very, very few. So this could, wouldn't be a problem, really.
They've had some positive tests, but none that expressed there's been transmission in the bubble. If that makes sense. Yeah. They had a few upon arrival, but so far 0. But they've released, the thing that's kind of weird is they release the test results whenever they want to. So we go, they're testing every day, but the results come every 7 to 12 days. And so who knows? We haven't heard anything in almost a week.
Do you know who's actually running the samples, or who you've contracted for the NBA?
BioReference Labs.
BioReference Labs?
Yeah.
It's interesting. I wonder if there's other, I think if the results aren't getting back, for days or a week.
Oh, they're getting the results back 12 hours. They're just not releasing them.
They're not coming to us.
Yeah. Oh, totally different. Yeah. Okay, got it.
It's a PR game, not a science game.
Yeah.
They're getting it back within 12 hours. They normally are
That makes
posting,
more sense.
a player will get a test during the day, and then like at 3 a.m, there's an account that, management can look at and find out how everyone's doing.
Okay, got it.
Yeah, but Major League Baseball is different.
Yeah, that's unfortunately true.
You have a line that I think this is actually not your line. I'm mangling it, but something like you can't stop every case, but you can stop every outbreak, something like that.
Yeah, and I think that's I say that a lot to companies and universities and other institutions that are trying to figure out how to deal with this. And so the approach, for example, that the NBA is taking right now, testing every single person, is kind of taking the biggest sledgehammer that we could take to ensure that there are going to be no cases. And as we're seeing, and I don't fault, this is a free market, a free country, and I think that money buys things. And in this case, it's buying a lot of tests for a relatively small number of people. That's not a bad thing, but it is taking this huge sledgehammer to a problem that to ensure that not a single case gets through and transmits to another person. And I mean, that's terrific. I think, we, from a health perspective for all the players and everyone else involved, I think that's really what, that is a good example of what can happen. But it's the most resource intensive way. It's kind of taking like a medical clinical approach to a public health problem by kind of treating or testing every single person every single day. And what I say to institutions, for example, that don't have the kind of resources like the NBA does is, look, you can save a lot of money and frankly a lot of headache in testing if you change your view a little bit. And the view that you want to go with is, we might not stop every single case, but we can stop every single outbreak. And to do that, we do have to have testing, but it only has to be a lower frequency of testing, because you might not find the very first case if you're just testing once a week, for example. But if you are testing everyone once a week, you'll probably find the second or the third case pretty quickly. And then you can adapt if needed. If you're just testing everyone, say you test 1/7 of the population on a Monday, 1/7 of the population on Tuesday, and so on. If you do find a positive case, then you take all of those extra resources that you're not consuming every day, the other 6/7 of the tests, and you throw them at the problem at that moment in time, test everyone comprehensively every day for 4 days, 5 days, and then you root out any additional cases that might have happened, and then you move back to weekly testing, for example. And that would be probably much more efficient approach, and you're really not risking too much there. Now, in the bubble, I would say that the way that it's designed, I think, I don't actually know well enough how people are sort of congregating within the bubble. If the assumption is that there's no cases and so people are really getting together and being teammates every night.
They're pretty.
They are.
They're confined to particular spaces and smaller groups, and they wear masks allegedly almost all the time.
Yeah. So I think in that sense, I would say, like, the last thing you want, especially for sports teams, is to have a super spreading event that throws a whole team out of commission for
like the Miami Marlins with 17 cases now.
Yeah. So that's, and I think that's why the NBA is taking the approach that it's taking, because nobody wants a super spreading event. But I would say that the likelihood of such an event happening, if you're testing everyone pretty frequently, is low, but it's not zero, but it's never going to be zero. But I do think, the NBA is in a good position not to be resource constrained, but when you're talking to small colleges that have to deal with thousands of people on a much smaller budget, things like that, or businesses, there's an approach of really taking a public health approach to all of this.
You mentioned Cornell. They're doing some. Can you talk about what they're doing?
Yeah. So Cornell is pooling samples, like I was mentioning before, and what they're doing is essentially collecting all the samples from everyone, and they're pooling. I think it's between 4 and 8 samples. I don't know exactly where they landed. So at the very least, it's cutting the test usage by by 5 or something along this line, 5x, maybe 8x. I forget exactly what they're doing. And that's a good way for them just to be able to really conserve resources and get a lot of people. Cornell's a big campus; they have thousands and thousands of people, and so they're able to do this pooling approach. And they were actually one of the ones that their provost, Mike Kotlikoff, was really working, I think, closely with the FDA to really get that push through. And that was a pretty big win, I would say, for the country to start getting pooled approaches through, which, they might not save time and they might not get rid of these bottlenecks that we're seeing right now in testing where people are getting results 10 days later. But it can potentially bring down costs, which for a lot of the country is just super important. And it can help conserve reagents, where right now it's like we're back in April right now. The hospitals, the laboratories, they're all running out of reagents again because cases are just through the roof. And it's a huge problem. And so anything that we can do at the moment to conserve some of these sort of precious tests is important right now.
Dr. Mina, did you read Michael Lewis's book, The Fifth Risk?
No.
So basically, it's to me the most impressive, comprehensive view as to how governments can operate. And in the book, one of the people he interviewed actually did kind of predict. He just said the worst thing that could happen to us will be a pandemic. But separate from that, it was a real exploration into where government can succeed and fail. So without getting you in trouble, can you speak at all to what we hear about the FDA and the things you're saying make so much sense, and we're not the only ones to think that. Is there a systemic problem with that organization not trying to get their arms around this and advance it?
It's really hard to say.
Yeah, go ahead.
What's that?
I said, if you can't say, I don't want to get you in trouble.
No, I've been pretty outspoken throughout this. I don't know if I would call it a systemic. There is a problem, and I think the problem there is that the FDA has been set in its ways for decades. It has its beliefs of what's important and what's not important, and there's very little room for the FDA to go off book and write new chapters. And one of those new chapters would be to how to evaluate new diagnostics differently. There's not even a pathway to do it. And unfortunately, at the moment, there's no political will to do it either, at least coming from above. The White House has clearly, I think in reality, has not made this virus out to be the real problem it is. And so there hasn't been political pressure placed in the right places. They do, but they have shown that they're able to, when the political pressure is placed upon them, they have shown that they are actually able to change. The speed at which these vaccine trials are moving is incredible.
Right.
And so that suggests to me that it's not a completely lost cause to hope that they might change. They clearly have completely rewritten the book of what their tolerance is for a vaccine trial to move forward. And absolutely, that's necessary. I'm very happy that that's happening. When it comes to testing, though, it's like a bunch of dinosaurs. They don't seem to be able to see things differently. And and I wish that they would, at the very least, to pay some attention to this topic. And it seems like there's some saying, it's like the definition of insanity is like trying to do the same thing over and over and hoping for a different result. They're just doing the same thing. That they are at the center of they have been at the center of the testing fiasco since February. The FDA and CDC, unfortunately, there were all these problems with the EUAs first and foremost, and tests being contaminated, not having enough tests approved early on. And there's just been it's just been this slow slog through the mud of trying to get testing up and running in this country with no real innovation. And here we are, the United States, I would say, with all of the problems we have as a country, we are one of, if not the most innovative countries. We certainly have the most firepower to be innovative. And if we can't figure out this problem, it's just astounding. Making a new vaccine for the world, that's a tough problem. making a new therapy for COVID, that's a tough problem. Creating a new diagnostic should not be a tough problem. The technology is there. We just have to do it, you know, and the FDA and Congress and others could actually, you know, Congress could appropriate the funds and say, we got to fix this. Here's the, you know, we're putting billions of dollars into vaccines. We just put $1 trillion package together for COVID response yesterday. Let's take $1 billion and put it into rapid diagnostics and not just count on some Shark Tank like competition to do it. Let's create, I was actually just saying it yesterday, not thinking about the fact that I was gonna be on the show, but I was talking to some reporters saying we need to create like the NBA All-Star team of test manufacturers. Don't rely on these different startups to each do their own thing. Bring the best minds in the world together. Pay them whatever money you need to pay them for a month. Put them in a room together, and just have them build the damn thing. And you know they'll come out the other end with a good product a month later that can be these test strips that I'm talking about that can really work, probably up to the FDA standards even. And give them $1 billion in R&D just to do it in a few weeks. Not a hard problem, but that's just so far removed from what our comfort zones are in this country.
It's like Apollo 14 order, right? This is like the scene where the, you know what I mean?
That's exactly right. I mean, we've seen that when the political will and money is there, the government can actually do amazing things. And they didn't, you know, the Apollo missions weren't based around hoping that this company and that company and that company would all have a Shark Tank competition and each have 30 people working on it. Some of the most promising tests right now, these paper strip tests, are companies of 3 people. Like, Jesus. You know, it's crazy. And you know, so I do think that this is a solvable problem. And it's a problem that if we did solve it, it would almost put us back into normal life again. In the same way that the bubble is, I mean, it's really replicating for the country what the bubble is spending huge resources to do right now.
How would you know though, if you're, let's say the miracles happen and Dumbledore waved his magic wand and all of a sudden we had all these great tests and kids could take them before they went to school every day and every employee and so have you. And so you suddenly test positive, and do you just keep testing every day until you're negative? But if that's the case, why wouldn't these tests continue to show that fragmented RNA, even though you've beaten the virus? Why wouldn't it still pick up that virus? Is it a different kind of test that it's okay? I see.
Yeah, exactly. This is a different kind of test. So this would be a test that's actually picking up like whole pieces of the virus, not the genetic code. And those pieces of the virus don't stick around for weeks or months. They go away once the viral replication stops.
You must be developing allies. Like you mentioned, talking to a senator. There must be some people emerging to help you along here.
Yeah, there are. There's senators, mayors, governors that I've been speaking with, congressmen, and some folks very close in the White House. So I think that it is picking up steam. Unfortunately, what I keep hearing from people who have been in the business of testing longer than I have is that nothing moves the FDA. You know. And they're somewhat independent as an entity. Of course, they're not fully independent, but they are given wide latitude to make their own regulations. And so I think that you know the best we can hope for is to get some political clout behind this to really get some of these folks to push on the FDA. And but to do it, I think will really require somebody like myself. My bandwidth has been pretty darn limited, unfortunately, but somebody like myself to sort of create the framework and write the outline of what these senators need to actually bring to the table to the FDA to push on them. And at the moment, they don't necessarily know all the details, so they're waiting on people like me to sort of do it. So I'm doing as much as I can, but I think there are some allies that are really on board with it, and I think it's gaining steam, and I really hope that, you know, through things like this and other media type things, it's getting the word out that there is a potential solution here, and it just needs some pressure and money.
There's this Actually, it's a Malcolm Gladwell reference. So Malcolm Gladwell has this thing where, like, when he was a kid, his dad would take him. His dad's a mathematician, I guess. And his dad would take him to a conference, and his dad could explain everything that happened at the conference. But now, decades have passed. Human knowledge is more particular, and his dad was like, "Look, I'm presenting in this room, and I can't explain anything else that's happening here, right?" And I feel like this is this odd moment where, like, someone like you've spent your life, and you have a tremendous amount of, you're integrating math and public health and testing and viral loads, and so when you share your specialized knowledge to, say, a senator, I think the senator is a little bit like, I don't know, maybe this guy's right, or maybe it's the other guy, or it's hard to say, right? And it's hard. I feel like there's this sort of, in the NBA, the equivalent is like 3-pointers came to basketball, and for 35 years, coaches were like, it seems weird. We just didn't use them. And like 35 years of like basically the use, and we're saying like, you guys, this is crazy. And finally they started using them, and now every championship goes to the team that shoots the most or close 3-pointers, right? It's,
yeah.
I think just mastery is very particular, and it's hard to communicate broadly now that it's so refined.
Yeah. I wanted to mention, so this is a question I get a lot. I saw it in the comments here. How would we ensure that people who stay home if they are transmitting? I think it's a really good question. Like, so that's a lot of people ask that. And the whole idea here is that the only way we're really going to deal with this as a society is to count on society to act appropriately. There's going to be bad apples. There's going to be the occasional person who tests positive on one of these paper strip tests, who goes out into the world and maybe spreads the virus. The idea is that that if everyone's using this every day, then if they do go and spread the virus, that's a shame. That's not good. But hopefully all the people that they spread the virus to will largely be good apples, and they will stay home if they get it. So I think that that's where we kind of have to not take such a personal approach to each case, and think and recognize the power of epidemiology and the power of what we do know about how infections spread. And if you have one case that spreads to a few people here, but all those people do stay home when they get infected, you stop the epidemic immediately, essentially. And so that's always going to be an issue, but it's not the biggest issue, but it is one that comes up a lot.
When you talked about like you'd have a piece of paper or some sort of documentation that you were negative today that you'd show before they seat you at the restaurant, or you walk into the gym, or that kind of thing.
Yeah, exactly. And you could show it. You could have timestamp. Maybe these things will come with apps or something, and you take a picture of your test every day, and it's got some way to ensure that it was actually you taking it or whatever it is. Exactly. I think that there's lots of ways. There's always going to be people who get around things, but society still functions with even despite people getting around things, and overall the averages are the driving forces in many times.
I'm a little, so you're talking about $1 billion and like 8 smart people in a room. And then you're going to want to kind of, I'm going to borrow a phrase from Silicon Valley, blitz scale, like the next phase, right? Isn't that what Silicon Valley does? Like $1 billion and 8 smart people, isn't that what they do? Like, where are they in this?
Well, that's been really surprising. From a testing perspective, we really haven't seen a lot out of Silicon Valley. They've been, in some ways, I think that Silicon Valley has been focusing on what they do well, which is software and trying to figure out, there are contact tracing apps that can be made. But I've been really astounded that there's been, outside of the people who are already like pretty big philanthropists like Bill Gates and things like that, we haven't seen a huge amount of dollars going into solving this problem coming from these companies, and I think that it behooves us as all these companies could be Google, the Googles and Apples of the world. They are doing, Google and Alphabet have Verily, and Verily is like their health branch, and they're doing some work, but these companies are practically trillion-dollar companies, and they could be doing a lot here. Take the interest they earn in a single day and put it into these problems, and it would go pretty darn far. But I've been a little bit disappointed to see that they're not leading the way here, and not even really appearing to try, despite that this is a problem, that's killing the people who make their platform successful. And, you know, it's just what's going on.
Do you see, so Bilal, one of our regulars, is a doctor in England who's been treating COVID patients. He has a question that I don't really understand that you might understand. I think there's a typo. Where does immunity fit in this model, perhaps?
Yeah, well, where do you see this last question. Where does immunity fit in this model as we're learning more about antibodies and T cell after testing positive with the paper test and then eventually testing negative, but you still need to be testing on a daily basis? It's a good question. So the question is, are people protected after they become infected? In general, all of the evidence is pointing towards yes, people are protected. Unfortunately, what happens in the media, and there's just a New York Times article that I was quoted in talking about this and a few other things. The media, of course, is going to root out and find the people who get reinfected because it's interesting news. You know, people want to hear these things. Or, you know, it's a little bit sensationalist. But the average person who gets infected with this virus doesn't get infected again, at least not anytime soon. There's always going to be the rare people who do get infected twice. But, you know, there's always fringe cases. Our immune system, they're not all perfect. Everyone's immune system is a little bit different than the next. And some people just don't mount good immune responses. Even something like measles. Measles is the quintessential pathogen that leads to really long-lasting immunity. There's even people who get measles twice. And so the fact that a few people are getting diagnosed, you know, even if it's thousands of people who are getting diagnosed twice with this virus, that's not going to impact things like herd immunity. It's still going to be a really small fraction of the overall populace. And most people, they'll get it once, they'll get tested positive, they'll recover, and then they'll have at least probably months, if not years, of protection after that. And ideally, if they do get infected a second time, their infection is going to be much less. The virus won't grow very much. And in many ways, it's actually what we expect to happen. The second infections are expected because they essentially boost your immune memory. They're just like getting a vaccine booster. Pathogens are the same thing. Little kids, they have to get infected multiple times with a pathogen, and then by the time they're 5 or 6 years old, their immune system is really good and recognizes those pathogens. It's I like to think of immunology and the immune system. We call it immune memory, and I think of it as completely analogous to our regular memory, to the way our brains work. I could
Not
tell
well
you
at all.
What's that?
Not well at all in my case.
Yeah. Yeah. And you know, and so we all know that you don't necessarily memorize things the first go around, but if you hear it a second time, you're much quicker to get the concept the second time around because you've already heard it the first time, and so on and so forth. And by the third time you've seen it, it's old hat, and you remember it well. And the immune system is pretty darn similar. You might not completely remember the pathogen the first time, but the second time you see it, you'll have a pretty good recollection of it. Your immune system can jump on it quickly, defeat it, but it still maybe grows a little bit inside of you, and it just serves to really solidify your immune memory even better. So these things are actually expected. It doesn't mean that the immune system isn't working against this virus. It's actually working exactly like the textbooks would suggest.
Fascinating. So we had, in this little town I live in New Jersey, I think the biggest Zoom call in the history of the town on Monday as the superintendent's explaining the reopening schools plan. And if you were an enlightened superintendent, coach, school official, university provost, etc., late July, these things usually happen in September. What do you do now? How do you use August?
How do you use August? It's a great question. You know, I was really hoping we wouldn't be where we are now in August. You know, we're kind of back in April in a way. I think people are really hitting up against an extraordinarily difficult decision right now. As schools are going to open at the end of this month or at the end of August. We were really hoping we would have very few cases and that we would have turned out to be like the rest of the world. You know, a lot of the world has gotten cases under control. But unfortunately, cases anywhere in the country make cases popping up anywhere else a reality. And I think it's a very hard decision that policymakers have to make right now, whether you're a superintendent or a mayor or governor, about how much to open up. I think that in Massachusetts, despite having really low cases, we might want to actually take baby steps backwards in terms of reopening as we're looking at what's happening elsewhere. And as they reopen, you know, we're seeing cases increase. And I really worry that the same is going to happen with schools. I'm a big advocate for, you know, getting the economy moving again. And part of that's getting schools open, but not if it's just going to bring us back to huge outbreaks again and start killing people in nursing homes. You know, we had some nursing homes and senior residence centers in Massachusetts where a quarter of the whole population died in April. You know, it's just terrible. And so I don't want to see us go back there. And so anything we can do to ward that off before it happens, I think is useful. And part of that might unfortunately be keeping schools shut down, you know, until we get cases under control. And I would love to say, you know, Massachusetts cases are largely under control, but we have Logan Airport here. We can't close the airport. Well, maybe we could, but you know, we have people, you know, an influx of people every day into the state from out of state. And you can't really, you know, there are quarantine measures being put in place, but you can't actually control those. And so we're going to keep seeing cases pop up. And as we have college students, you know, we'll have hundreds of thousands of college students come back to the Northeast from all over the world, or at least all over the country. That has the potential to be a disaster if they all come back. And so, you know, a lot of schools are really concerned about this. And, you know, if colleges start seeding new outbreaks, then it's going to spread to the school systems. And then very quickly, this is such a transmissible virus that these outbreaks can get out of control. And so we're, you know, until we can get cases across the country under control, we're all at a pretty high risk of new outbreaks occurring.
Is there a way to follow in Cornell's footsteps?
Yeah, a lot of schools are doing it. But it's a pretty hard lift to do that across society at large. So Cornell, again, has a lot of money that they can do it with. We're doing something similar at Harvard. I'm helping lead that effort, both at Harvard and at a lot of schools are doing it in the Northeast. And but when I say, like, okay, it's one thing for these private universities to do it. It's a whole different thing for public school systems that don't have enough money to get their kids school books to do it. You know, this is something that's practically going to bankrupt a lot of like private colleges, and these are wealthy colleges. It's really pushing their budget. So it's tough. It's really tough, and there's no good solution. I think the best solution is to just, you know, it's these cheap tests, it's masks, it's getting the cases under control everywhere. So then we can, if cases are under control everywhere in the country, you know, then we deal with one outbreak at a time, and the risk overall becomes very low. So that's kind of the only real way to deal with this virus, you know, short of making real barriers across the states to say, okay, we're Massachusetts, nobody can come in, or something like that. You know, we're still a single country. You know, we might be divided, but
yeah.
But you just mentioned masks for the first time, and I assumed because you're a scientist, you've never been suggesting that we should be doing the testing and then no one has to wear masks. You're saying, at least for a period of time, the distancing, the masks, and the tests all together could really get these cases under control nationally. Oh
yeah, I think masks maybe more than anything. We look around the rest of the world and we say, what have especially the East Asian countries done? Well, they have a culture where they wear masks pretty frequently, and masks go a really long way. You know, there was this weird, you know, another failing of at the federal level early on was the CDC and others saying, you know, don't wear masks, they're not useful. They were saying it in large part to get to conserve masks for the hospitals.
Right.
But you know, lying to the public or being disingenuous to the public about the role and utility of masks in order to get them to not wear them was not the right approach, because it led to huge confusion. And it led to this whole ecosystem of people thinking masks were pointless. It's no surprise that masks work here. There's a reason in the hospitals we wear masks when we go to see patients who have infectious diseases. and we're the physicians that don't have them. We wear them to protect ourselves when we go to see a patient. And so it's just the strangest thing to hear the CDC say masks aren't going to help you not get infected. That was like, completely bonkers. And I'm glad to see that everyone's changed their tune, including the president now, because they do help. They will help. I mean, I would actually feel pretty darn comfortable going into a patient room who has COVID if we're both wearing masks and talking to them and feeling like I'm pretty secure in not getting COVID. And that's just because they work so well.
That's an important statement, Henry. And to be fair, not that I really want to be fair to the federal government, but when they first were saying about masks, in addition to the PPE issue, we thought then it was more surface transferred. So surface to fingers, they were worried about touching your face. I don't think they realized it was as respiratory in terms of the airborne part of it as we do now. Right? Isn't that fair to say?
Yeah, I think, but anyone who was thinking it wasn't so respiratory is, I completely agree with what you're saying. That was certainly the word on the street, but there's been this running theme throughout this whole epidemic where everyone has questioned everything they've ever known and been taught. But it turns out that including something like saying, oh, maybe coronavirus is primarily transmitted by surfaces. Like, this is a pretty clearly defined respiratory virus, but it's happened in every step of the way, including now with immunity. People wondering if people are going to develop immunity. I look at things really differently because I have the luxury of frankly having a lot of training in a lot of different fields,
right?
Medicine as well as virology and research and math and all those things, and so I have a slightly different outlook and being able to kind of integrate mechanistic things together. And when you take that approach, not a single part of this virus has veered away from the textbook at this point. It's like the quintessential textbook virus, from the immune response to the transmission. All this stuff is as we anticipated. But people got in this frenzy early on with the epidemic and just thought that all of our prior knowledge was thrown out the window with this virus. And the more we learn, the more we realize we had it all written out for us in chapter 1 anyway.
Wow.
So it's been interesting to see it all come through.
You've really highlighted an issue that I've been thinking about for many months now. We have had an enormous messaging problem, even to the point where I've always hated the idea of social distancing. I felt like we should be saying physical distancing, but social connection, because people get lonely, and if we can't be with them physically, we have to find other ways, which is not so hard with technology now. We've got messaging wrong from day one on this.
I can't agree more with you on that. And I don't know if it was you or I read it somewhere where somebody was saying the same kind of thing, where we should never have called it that, because that has all these connotations. It leads to depression. It leads to all these things. And absolutely, this should have been, some other. Social distancing was always the wrong word here. It should have been, things that advocate for people's lives to move on in some sort of normal way, in a positive way, while mitigating transmission and preventing transmission. And couldn't agree more with you on that.
So we end the show every time with Gerard Hector has a better question than David and I have. I don't know why we don't just have him on the whole time. But but while he's joining us, I will just note, David, a year from now, what I'll remember about today more than anything is Dr. Mina very casually said, no, I'm not into sports, but I did compete as a rower in college, which makes him significantly more accomplished as an athlete than anyone else on the show. We're the ones that are into sports.
Right. Not a sports with balls anyway, but
okay.
My niece was yeah.
Look, Gerard's in Hawaii. What's going on?
I that's why I said, whoa, I have no idea what that is or what happened. I must be signing in under a different name. It doesn't matter. Michael, this has been great. So thank you for joining us. I think something I want to touch on that you talked about really throughout, you mentioned that you have the luxury of being trained in many different disciplines. And the other thing about you, which is so evident, like, you're very measured in how you're talking. You're not letting emotions guide you. You're not freaking. It's very just like, this is kind of what this is. Like, I wonder, because you're at Harvard, so already like you're around a different caliber of person and mindset and thought versus like the average person walking the street. And we're relatively fortunate on this Bring It In that I'd like to say the collective intelligence in this group is
very smart. Very, very smart here.
But like that's not how it exists like out there, right? Like everyone just literally, it's if we don't have an answer to something, it's let's freak the fuck out and like, well, it must be this. It's like, how are you dealing with people who are not in that kind of space that you're in, and how are you talking to them? Because I could see how your measured approach would drive them batshit crazy. Like, just tell me something. I didn't answer. And you're like, dude, but it's not how it works. Like,
well, it's hard, and I work hard to make concepts approachable to the audiences that I talk to. When I go on to CNN, for example, or something like that, and I have to recognize that I'm speaking to millions of people, most of whom didn't go to college, and so I try to, on the one hand, get things approachable, but on the other hand, it is really difficult because then I'll get like a flood of emails from scientists saying, I can't believe you said that, it's not completely accurate. Like, how could you say that? It's like, well, it actually comes from—
People are not your friends.
Yeah. So this comes from this, I learned it actually while rowing. I attribute this to this guy, Chris Wall, who was my rowing coach at Dartmouth. And I was recruited. I would say I was a nationally medaled, rower in high school. And so I was recruited into college, and most rowers in college are novices. They walk onto the team during college. And so here I was, having rowed for 5 years at the time. And Chris Wall, my coach, is like teaching them the wrong thing to do with rowing. That he wasn't being completely accurate with how to teach them how to take a rowing stroke. And one day I just flip out. I'm like, why are you teaching them the wrong thing? And it was a lesson that I'll never forget. And he said, like, you need to teach them the basics first. And sometimes to just get them to learn the basics, you have to forget about some of the nuanced details that you are focusing, that I was focusing on, and allow them to make this mistake here and that mistake there, if it means that they can get the damn blade into the water. And that's something I've carried with me throughout my life since then, which is just, you don't have to be completely accurate with everything, because if you do at the expense of people completely missing the whole point, then you have completely failed versus just sort of failed in little bits but succeeded in the big picture. And but you're right, Jared, that it's really difficult. People do freak out. People have their, especially when you give when you take a very measured and kind of like calm approach to suggest something that doesn't fit within somebody's framework that they normally live in, they freak out. they come up with every possible reason why you must be wrong, and completely fail sometimes to see the big picture and to say, oh, maybe that's actually useful. It's a really hard thing to deal with.
So much of it too is people not believing, as you mentioned before, things we already taught about, like it's actual science. And that's a dangerous place we are in this country, right? Where people say things like, oh, I don't believe in X. And I'm like, but it's not religion. It's already been proven like a zillion times. Like, what do you mean you don't believe in gravity? Like, what? Like,
yeah. No, it's like people saying, pre-COVID, I've worked a lot on vaccines. And so I interface a lot with the anti-vaccine people. And
I want to hear this. We know that. Let's go.
That's for a different show if you want.
Yes.
But it's been amazing to see, people say things like, I don't believe in vaccines, or I don't believe in herd immunity. Like, herd immunity is not something you can choose not to believe in. Herd immunity, saying you don't believe in herd immunity derived from vaccines is like saying that you don't believe in immunity at all. It's like, we know, just look at any of the data out there. We know vaccines actually work to get rid of infections, and that's herd immunity. And it's just been so strange to see people use the word believe as though this is religion. Science, we have literal facts in front of us, and you could say, I disagree, and this is why. But belief is not a part of this, and it never should be.
We are emotional creatures. We just are. Like,
Yeah,
we just get emotional about everything.
It's true. Yeah.
We are out of time, unfortunately. Oh, go ahead. You have something else to add?
I do have to run, but I wanted to just say really one thing, because there was an important question, and someone asked it and just said, are vaccines going to come about? And I just think everyone's wondering this. And I do think the point that in brief, I think, yes, vaccines will come about. They'll probably even come about this fall or winter. But we don't know how well they're going to work. They'll probably work decent, to abrogate disease if somebody gets infected. But we will start to see them, but it might not be the grand slam that we're all hoping for, that it will completely get rid of this virus. And so I think we have to really take each advance with a slight grain of salt. But I do think that we should expect a vaccine will become approved, but we should also look at it with a little bit of caution once it does, because we won't really know extremely well yet how well it's going to work until it gets out to millions of people.
That's because it's
still do these other things. We still should get these daily tests and all of that too.
Yeah.
You don't have enough time to do the full-on trials and to get to, because if you had next spring, next summer probably is when you'd have enough time for that, right? But we wouldn't. That doesn't seem likely.
That's right. Yeah, things are getting pushed through really fast. There's an immense amount of political pressure. I mean, frankly, if I had money to invest, I'd be investing in Moderna and AstraZeneca, right now, and because there's so much political pressure to get these vaccines out that there's almost, it's just like the banks. They're almost too big to fail now. The politics, the one thing that would cause them to fail is if some people die in phase 3 trials from an adverse effect. So, but that will come about, we'll be able to see that, over the next couple of months. Short of that, and I don't have any reason to believe that it necessarily would happen. Short of that, I think that there's just so much momentum pushing these things forward that there's only few avenues I can see that will derail it at this point.
I know you're so busy. Thank you so much. This is amazing. You're the first person to use the word abrogate on the show, and I want to thank you for that too. Really, let us know how we can help. Whatever comes along, reach out. We want to help.
Yes.
All right.